All right, welcome back. This is Drew, the knee pain magician, as some people call me. And what we're going to be doing this week is focusing on improving your breathing habits. So, obviously, this channel is dedicated for people who are struggling with chronic knee pain. Maybe you are someone who has bone on bone deterioration within your knee. You've been told you have osteoarthritis, arthritis. Maybe you have some other soft tissue that's damaged, torn MCL as an example. If so, you've come to the right place. This channel is dedicated to getting you feeling and moving better. What makes my work unique is that I take an understanding of the brain-body connection, and I show you how to improve that by simple exercises, simple drills, so that your brain feels more connected to your body and allows you to move your knees, move the rest of your body without pain or restriction. So the reason why we're working on breathing, you may ask, well, why are we breathing? My knee hurts, right? I breathe just fine. That seems to be most people's immediate reaction. So what we mostly do on this channel is focus on improving the way you move your body, whether that's mobilizing the knee itself or perhaps the joint below or above, or sometimes we even work on other exercises like nerves and vision. All those things are about moving different parts of your body better, whether that's the joints or even your eyes. Today, we're working on breathing. One of the things I've noticed after doing this kind of work for 9 years, helping different people, is that oftentimes people who are struggling with pain, whether it's their knee or their lower back, they come into my clinic and they kind of hold themselves like this and they talk about, oh boy, I've got so much pain in my knee, I just can't move that well. And the reason why I'm doing this is because that's kind of how they're holding their body. They're not breathing deeply at all. And when I try to bring some awareness to it, they have a really hard time understanding that they've been really shallow breathers and that they're very restricted and tight in their chest and upper shoulders. As soon as I can bring a little bit of awareness to how they breathe and show them a couple of simple exercises, helps them improve the way they breathe, they can see immediate relief, right? Maybe their knee pain goes from an 8 out of 10, very high level, down to a 5 within 30 seconds. So this isn't crazy. It's not magic. What it is simple neurology, right? Giving your brain more reassurance about what's going on in your body, helping reduce that internal stress, and then magically you feel and move better. So today what we're going to be doing is looking at one simple assessment to help you understand how you're breathing. If you're a shallow breather, do you hold your breath? Or are you able to breathe more deeply and move and expand your lower lungs and your ribs and your belly? In addition to the assessment, we're going to work on two very simple high payoff exercises that even some Navy SEALs, elite athletes, use when they're in a stressful environment to help them reduce the stress and perform better. Okay, so if you're familiar with watching my channel and going through some of the exercises that I coach, the first thing we always do before we do an exercise is an assessment. So where I got my education from, his name's Dr. Cobb, and he runs an organization called Z Health Performance. What he teaches is that if you're not assessing, you're guessing, right? So when it comes to your knee pain, we don't want to guess if the PT exercise you received is right. We want to assess and make sure that you're actually improving. So the only way that we know that is by taking you through a range of motion assessments, which could either be you standing up and going for a walk, coming back, paying attention to how you're moving. On a scale of 1 to 10, my right knee feels about a 6, so it's not terrible, but it's pretty up there. Or maybe when you're walking, you notice that you have a limp, right? And you're trying to void the leg that you have pain. Or perhaps you notice your chronic knee pain when you're bending down, right? Sitting down in your chair, sitting down in the toilet, standing back up, getting off the couch when you're watching TV. Any of those things are good barometers for you to use as a means to assess and check if what you're doing with your body is helping you or not, right? Because we're trying to focus on the things that are the most helpful. So first thing I want you to do before I coach you through these exercises is I want you to stand up and get up from the computer, go for a little walk, try a few squats, and check in with how your body's feeling. Like on a pain scale, 1 to 10. 10 being, oh my God, this is terrible. I'm going to take a couple Oxycontin now. One being, hey, I'm ready to hike up Mount Everest. Like, where are you at the moment, right? So do a brief little assessment, come back, and then we're going to move on to the next. Okay, so the first thing we're going to be doing today is working on assessing the mechanics of how you breathe. So earlier I was kind of making fun of really just being restricted and tight and like this. And what we're trying to do today, one of our goals, first goals, is give you more awareness of how you breathe. So how do we do that? One thing, you're going to put one hand on your chest. You're going to put one hand on your belly. I want you to be nice and comfortable, not self-conscious. Here you are at home, taking it easy. And I just want you to breathe as normally as possible, right? We're not trying to change anything. You're just trying to breathe normally. As you're breathing, I want you to begin to notice where you feel movement. Like I was saying, most people who have chronic level of pain, they are kind of top breathers. And so when they do inhale, they breathe into their chest or they breathe into their shoulders like this, right? So I want you to pay attention while you're having a hand on your belly, while you're having a hand on your chest, where you feel movement when you're inhaling and when you're exhaling. What we're ideally looking for is that when you do inhale and exhale, you mainly feel movement into that lower palm, right? Nice and relaxed up here. You're not stiff in the shoulders, moving in the chest. You're inhaling into your belly. And when you're exhaling, the belly kind of collapses and the air comes out from the bottom of your lungs. Maybe you can see me from this position. So I got a hand on my chest, hand on my belly, inhaling in through my nose, exhaling through the mouth. Inhaling through the nose, exhaling through the mouth. Notice my belly's moving in and out as I'm breathing, right? I'm not pulling in air through my nose and then really raising my chest. Everything's nice and relaxed. So when you're relaxed up here and you're able to breathe more deeply into your belly, we're able to engage your diaphragm. Your diaphragm is a big muscle that's mainly responsible for respiration, and it separates your lungs from your internal organs. But when you're used to kind of holding your breath and breathing top heavy, you're not really engaging that muscle, and it's really important for having pain-free movement throughout the entire body. So after you do kind of this like compartmentalization, top half, bottom half, thinking about where you're moving mostly from, what I want you to also do, you're going to take your hands like this, and you're going to wrap them around your lower ribs. If for whatever reason you have a little bit of arthritis in your hands, or maybe you've got a stiff shoulder, you could also take an elastic band, an exercise band, or wrap that around your ribs. But what this does, whether you're using a band or using your hands, is it gives you a little bit of proprioceptive feedback. So your brain is able to say, aha, I do feel my ribs, right? I do feel my belly. And when you have that target or that awareness, you're able to kind of do the job you're trying to do. So I'm just like this or here. And now, instead of just breathing into the belly, what I'm doing is also trying to breathe laterally, right? I'm trying to expand into my lower lungs. As my lower lungs expand, they inflate my ribs, which push out. Again, I'm kind of soft in the shoulders and the chest, and I'm really trying to focus on getting movement down here. As I'm inhaling, right, I want you to think of kind of a 360 degrees, right? Your lungs aren't just moving forward and backwards, right? It's a circular movement, if that makes sense. So when I have my hands like this, I feel some movement going forward into my ribs, into my thumb. And that's kind of the easiest to feel that movement. But I also want to feel movement laterally. I'm expanding out as I'm breathing. And you're going to feel this even less, but just having some movement into the lower back is also important. So here I am here, Inhaling in through my nose. And I feel a little bit of movement. My back expanding into my fingers. This could be a really good exercise, not only for knee pain, but if you have lower back pain. Being able to breathe, or kind of having that brain-body connection, breathing into the area where you have some stiffness can be a really helpful tool. So that's the first exercise. Hand on the chest, hand on the belly, hand on the sides, paying attention to where are you breathing. Are you really restricted and top heavy? Breathing into your shoulders, breathing into your chest? Or can you be nice and relaxed, easy, comfortable, able to have a deeper breath, more diaphragmatic breathing into your belly, able to mobilize those ribs, get some movement into your lower back? So that's an assessment of the mechanics of how you breathe, but it's also kind of an exercise. So after you've done that, what I want you to do is stand up from your chair if you've been sitting, go for another walk, pay attention to the pain scale in your knee. Are you feeling and moving a little bit better? Do you have less of a limp while you're walking? When you try to bend down, touch your toes, or do a few squats, do you feel like you've got less pain, less stiffness, and a little bit more confidence in that range of motion? So once you do that, come back and we'll work on exercise number 2. Okay, so the good follow-up exercise to once you get this assessment, figuring out the mechanics of how you breathe, something called box breathing. So box breathing is a really simple exercise, but it can have a big impact on how you feel and move. And some of the people who use it are special forces, Navy SEALs, Olympic athletes. So if these high-performing individuals can benefit from the exercise, the chances of you benefiting from it are pretty high, right? So it's worth a shot. So I want you to think of a one-dimensional box. 4 sides. Each side is going to be represented by 4 seconds. You're going to do a 4-second inhale in through the nose. You're going to hold that breath for 4 seconds. You're going to exhale through your mouth for 4 seconds. Hold that breath for 4, and then you're going to repeat. So, one-dimensional box, in for 4, pause for 4. Out for 4, pause for 4. Very simple. What I want you to keep in mind while you're doing this is where you're breathing. We don't want to go back to the upper chest, go back to the upper shoulders. I want you to pay attention to the lower lungs, your belly, lower ribs out here. Relax and be soft on the top side and try to have more movement down here. When you're inhaling in those 4 seconds, I want you to bring in as much air as you can. Fill the lungs. When you're exhaling, I want you to press out and expel as much air as you can and hold that for that 4 seconds. So I'm going to walk through one round, right, kind of demonstrating it as I go, and then I want you to repeat this for 1 minute on your own. So again, here I am, right? I've got a nice tall spine, good posture. Everything's relaxed. I'm not holding tension in my shoulders. Close your eyes if you want. One hand on the belly, one hand on the chest. And I'm going to inhale through my nose into my belly or into my side ribs for 1, 2, 3, 4. You're going to hold that breath. 1, 2, 3, 4. Now pushing out all the air from the bottom of the lungs through the mouth for 1, 2, 3, 4. Hold it. 1, 2, 3, 4. And then repeat in through the nose, into the belly. That's the exercise. Very simple. In for 4, pause for 4. Out for 4, pause for 4. Nice and soft in the chest and shoulders, trying to get more movement down here. Again, very simple exercise. Box breathing, right? You could do it sitting in the car when you're stressed out. In general, this exercise tends to work really well for people who are dealing with a high level of pain and maybe also dealing with some social stressors. If you're someone who's paying attention to what's going on in the world, the news, like anybody else, it's a stressful time period. So having a simple exercise that's just a little bit grounding, kind of gets you reconnected with your body, paying attention to how you're feeling. Not only is it going to help reduce some internal tension you're holding, but that can have a profound impact on just general movement quality, which includes your knee. All right. Okay, so we did our assessments, paying attention to how the mechanics of our breathing are. We worked on that box breathing. Now I've got another kind of unique, magic-like tool that could help probably a lot of you. So if you are someone who struggles with good breathing habits, maybe you are over-oxygenated because you breathe too much through your mouth, right? There's something called restricted breathing. And restricted breathing is basically an exercise that is increasing the carbon in your bloodstream because it's limiting the oxygen you're pulling in when you're doing an exercise. So to do that, I've got this little bag in my pocket. So if you have a sandwich bag or even like a brown paper bag for a lunch, it's a simple tool that can really provide you with some significant relief. So what you're going to do is you're going to wrap this bag just like such around your mouth, around your nose, trying to seal off any air from coming in. So again, if you were to look at me, looks like this. And what I want you to do is you could sit down, stand up, doesn't really matter, but I want you just to breathe normally. And if you have an underlying problem, you may start to feel like a little bit of a panic sensation. That's okay. Maybe you could try this exercise for like 30 seconds or so. I want you to take that bag, set it down, and of course, we're going to have you stand up and reassess. Go for another walk, try your squats, try your toe tests, pay attention. Now that you just did this simple breathing exercise, change the level of carbon and oxygen in your bloodstream, how does your brain take that information and change the way you feel and move? So that's called bag breathing, right? I want you to give that a shot. If you don't have a bag, there's another way you can do there's another way you can do an exercise without the bag. So this is called restricted breathing. So basically what you would do is full exhale of the air in your lungs. So you would go like this. Take a breath in and then push all the air out. Close your mouth. Don't inhale. And then you would do some form of activity until you were forced to take some oxygen in. So again, what's the exercise? Take a nice breath in, push all the air out of your body, don't inhale, and then do some kind of movement, whether you're walking up and down your apartment floor, you're going up and down the stairs outside your house, you're doing some kind of activity that forces you to work, right? And then you're going to keep doing that work until you feel like you have to take that inhale. That's the exercise, right? Seeing how much movement you're able to do on that empty lungs, not having any breath inside your body. Again, seems bizarre, seems strange, but simple concept, right? Giving your brain a little bit more carbon, a little bit less oxygen, that can have a big impact on how you feel and move. So after you've done either of those two, whether you do the bag breathing or whether you do the restricted breathing, where you're moving on empty lungs, right? I want you to reassess. You go for another walk, try your toe touch, try a few squats, check in with your body and see how are you feeling now. Okay, so wrapping up our exercises for today, we talked about the importance of better breathing habits. If you're someone who's paying any attention to the world, your chances are you're probably a little bit stressed out. You've got a lot going on, no matter if you're in the United States or somewhere else. That could cause internal tension. We're a little bit stressed out. That's obviously going to have an impact on your knee pain. So having a simple tool just for you to get a little bit grounded with your body, paying attention to how you're feeling, it's going to help you reduce that internal stress and tension. That's also going to have a big impact on how you feel and move, including your knee. So simple breathing exercise, we worked on the mechanics of how you breathe, paying attention to being nice and relaxed in the upper half of our body, being able to breathe more diaphragmatically, lower belly breathing, mobilizing those ribs, thinking of that cylindrical breathing, not just moving the belly, but moving the lateral part of the ribs and the backside, right? We worked on box breathing, really simple but powerful tool. Take you 60 seconds or less to get big impact. Then we also worked on changing the composition of oxygen and carbon in your bloodstream, working on acidity levels. Sounds crazy, but it really works. I've seen it on myself and lots of my clients. You could do that a couple different ways. If you've got a paper bag, amazing. Sit there for 30 seconds, rebreathe your own air. If you don't have a paper bag, not a problem. You're just going to empty out all the air from your body, do some form of activity, not till you break a sweat, but just until you feel like, I got to take that breath. Changing the acidity in the blood by removing some of the oxygen can have a big impact on that knee. So a couple of simple tools to help you think about what's going on with your body, where you may be having a little bit of an issue. So last but not least, being able to breathe well is really the foundation for anything, right? You know, oxygen is life. And when you're breathing, it's helping kind of solidify all the stuff you're working on. No matter what you're doing, whether you are, working on mobilizing your knee or some of the joints in your body, maybe working on some nerve glides, or maybe you're even a little advanced and you're practicing some of the vision exercises you've seen on my channel. If you're not conscious of holding your breath, the exercises that you're doing are not going to have the same sticking power. To really have your nervous system function at a high level and for oxygen to travel in your tissue, you have to be able to breathe well. And just paying attention to, innately, how are you breathing? Making sure that you have that skill down, that you're conscious about it, that you have a couple exercises that can kind of help you through that process, that can help and really is a foundation for everything else. Breathing, right? You gotta breathe well. So hope this week's video was helpful to you, improving your breathing habits. If so, I always appreciate your support. If you could just like the video below, subscribe to my channel, that's great. If you're someone who's been struggling with chronic knee pain for a long time, you've tried lots of different things, but have yet to find results. If you're interested in this approach, I encourage you to watch my free training below. It's a webinar that talks about all these big concepts and how they relate to giving you lasting relief for your knee pain. You can check that out free below. So thanks a lot. Let me know in the comment section how you benefited from these breathing exercises, and we'll talk soon. Okay, bye-bye.